So, welcome to episode 5 of the TEDS Health podcast. I am Dr. Johnny Andrews, Medical Director of TEDS Health, and I'm joined by two excellent colleagues here and fellow panelists. So, we have someone new today for the first time. We've got James Davis. James, would you like to tell us a little bit about yourself?
Yeah, so I'm a coaching psychologist and I specialize mainly, I guess, what we call midlife transitions. So I do work with men and women, but I tend to skew more towards male clients, helping them basically go through midlife and find out what the next stage is for them. So I work a lot around values, where do I go next? How do I find fulfillment and purpose in life?
Amazing.
Yeah.
We'll definitely dig more into that. And James and I have been connected for a couple of years, and this is our first
at least a couple of years
in real life meeting as well.
I know.
On a podcast.
Fantastic.
So what a better way to do it, eh? And then our longtime collaborator, Ollie Matthews. Ollie,
I'm Ollie, and I run OJ Health, so it's men's health primarily, a functional medicine clinic, and on a mission to make sure that 1 million dads don't die before seeing their children grow up.
Very admirable, and definitely support that as a dad
Thank
myself.
you. Yeah.
So, James, let's begin with you. Tell us what's been happening, what's new, what are you seeing, especially in your space when it comes to men's health, which is an ever topical area?
Yeah. Well, I think I've seen a couple of things. And the first one is kind of on the mental health side. So I do a lot of work with organizations, and what I'm seeing with leaders is a lot of a sense of overwhelm, primarily driven by the speed of tech, particularly AI adoption. So organizations are, I think, in a bit of a panic of like, okay, this new thing, AI, how do we adopt it again? So it's just like, how do we leverage it in without really understanding what the long-term goal would be? So I saw some research that said, I think it's back in 2016, the average major change in an organization was 2 per year. By 2020, it was already like 16 per year, and that's accelerated since then. So people are getting these like change initiatives, and often like they haven't even completed the one before there's another one because there's been a pivot in direction. Mm-hmm. So I'm terming it resilience 2.0 because I think the old resilience term was good, but it was kind of like how do I push on through? How do I optimize to push on through? I think
like hustle culture.
Yeah, hustle culture. And I think now there's a real need for like, well, how do we build resilience to actually live a little bit in the uncertainty of the world we live in? We have got AI disrupting, we've got the geopolitical situation as well. And really look after my own health, my colleagues, my teams, my partners, and come through the other side still performing well. So that's what I'm calling resilience 2.0. So that's the first one. The second thing I'm seeing, which I'm sure Ollie will probably talk about, is there's been so much press about peptides. So I'm always getting people like, what about peptides? What peptides should I take? And I'm like, well, it's not really that simple. It's so peptides is a big thing, and perhaps we could touch on because it is quite a big talking topic. And I think, again, certain elements of the press kind of pushing it or unscrupulous, maybe organizations saying like, yeah, this is the answer to your problems, when of course it's not that simple.
A lot of misinformation, and I think we're blurring lines as well. You speak about AI and kind of misinformation, and there's also a lot of AI slop as well, right? So whenever there's commercial entities who may not even care about anyone's health and well-being, seeing where they can make a quick buck. So I think peptides is obviously one area that we're seeing a lot of interest on lots of sides. We'll go into why. We'll talk about the US, the FDA, kind of all of that kind of categorization and stuff. We'll also talk about maybe some of the good aspects and the interesting research, where some of it being early. And we'll also talk about the regulated ones as well, right? Remembering that peptides include medications like GLP-1s, okay, which are originally used in diabetes management and obesity, but also now weight loss and a ton of other medical conditions, of which there's even more research showing their potential benefit, and obviously the safety profile data there that they've gone through rigorous clinical trials. But I think that's fascinating. So that's 2. What's 3? Because I know you're also quite an active writer as well.
Yeah, so 3 is I'm working on a new book. As you know, I have my first book, the Midlife Male Handbook, A Man's Guide to Thriving Through Andropause. But I'm working on a book with my wife now called Couple Pause. And this is what happens when andropause meets menopause, because we all know midlife relationships, it can be a really challenging time. Unfortunately, midlife divorce rates are on the increase all the time. They're mainly initiated by the female in a relationship. And I've kind of got my own views on that we explore in the book. I know you've very kindly written a little bit of an expert comment in there for us on one of the chapters around andropause, but that's going to come out later in the year, like late October, early November. But yeah, writing a book as a couple is also an interesting challenge.
How's that on the relationship?
Yeah, well, we actually made a joke of it. We've written a whole section of the book, and we thought this was going to be easy. Whereas actually, we've had to draw on a lot of the tools we were going to use to actually get this done, like communicate clearly, set expectations, set boundaries. So it's been an education, but we really enjoy it.
So it's been a journey.
Yeah, definitely.
Has it been a form of therapy? Would you say? Would you recommend it?
Yeah. Well, I'm not sure if I'd recommend going straight into the book, but you know, it has taught us to kind of communicate on a different level, step back, going, okay, you know, keep checking back in. What do we both want to get from this, and how we're going to find that place where it meets up for us together. So it's been really instructive from that perspective.
That's awesome, James. Well, pleased to dig more into that and more. Ollie, what's the latest?
There was an interesting stat on a podcast on the way up here, and it was saying that since 2019, this is an American stat, American podcast, that 18 to 25-year-olds, the amount of testosterone prescribed by doctors has actually increased by 140% in that age bracket, which to a degree, it's helping that population where it comes, like they might have low moods, that they're seeing the signs of low testosterone, which is worrying at that age, right? But also, what's the later impact on, or the latter impact on fertility and later down the line? And this is where we go into the responsibilities of doctors prescribing, and are they making people aware of the potential side effects, the impact on fertility, the prescribing before doing everything else. And I thought that was just very interesting, because we always talk about actually people using underground labs versus the clinic, but actually it is getting easier to get testosterone prescribed by getting the test and everything else. But how much responsibility do we also then have to have on doctors and clinics? Like, just like we could talk about, like with TEDS as well, like we have to have responsibility to let people know everything that could potentially happen, which is still potentially unknown long term, right, with actual studies.
Absolutely.
And then the peptide side of things as well is, like, as I've said before, like, I love peptides. I use different ones myself, and it's very much that I see people come to me on Instagram and they say, I'm on this peptide, that peptide, and they're probably spending £400 or £500 a month on peptides. Like, they can get expensive. But then I actually say, where's your testosterone at? And they haven't done testosterone as a blood test at all. And when we look at peptides, the optimization, I always just say that we need that foundation of good hormonal health. If we're not doing the basics, you're wasting your money. You might get 5% of the results if you've got a decent source from it, if you're using good quality peptides at the right levels. But if your testosterone's not good, you need to work on that first. If your sleep's not good, you need to work on that first. If your gut health's off, if your training's off. And I think it's interesting because we see high-level influencers. I say high-level influencers as in, like, their numbers are high. Doesn't mean their content, their knowledge is high, right? Yeah. And they're pushing these things. And I got approached by a company, and I've spoken about it, about like doing a brand deal for their more cosmetic. They said about hair transplants, teeth stuff and everything. I'm like, I've never even thought about a hair transplant, but I won't promote something unless I've had it. And they're like, well, we'll give you a hair transplant. I'm not even sure I want a hair transplant, to be fair. But like, when it gets to even more than it is now, I'm like, I'll just shave it off. But people are getting approached to promote things based on commission. And like, I'm hands up, I am considering like the transplant side of things, like to see it, because again, like if I'm going to promote it, I want to go through it, but it's going to be like, do I really need to do it? And I think this is where it gets a little bit worrying on social media, because people will promote supplements. They'll promote the latest. I've seen someone tell me, so I've got an Oura ring, and I've got my Garmin as well. And I know one guy who's very high up in the biohacker space. A few years ago, we were at an entrepreneur's retreat. He was talking about how the Oura ring like really helped him, and the things there really helped him get off alcohol. But I've seen him promote that a different ring helped him get off alcohol. And I'm thinking, I literally know you, and I know that that wasn't the case. Seeing the numbers on that. So it's the awareness, I suppose, around how influencers are talking. And I suppose that could then go into the topic we were talking about with technology, and can we become obsessed with technology as well, right?
Absolutely. Yeah, do you want to just share that last thought, actually? And that was captured before we...
like when this actually goes out, it'll be like a couple of months down the line from when this came out. But recently, Diary of a CEO, Stephen Bartlett had said about he had a couple of glasses of wine and it completely destroyed him for 3 days. And you have to watch the clip a little bit longer and I suppose go into the episode. I don't really listen to podcasts that are like 2 hours long, to be fair. But people were kicking up a fuss about it. And as we said, Greg James has said that we need to stop being obsessed with this stuff. And if you're feeling shot for 3 days after having 2 glasses of wine, how bad is that person's health? But I would also argue as well, like I'm not obsessed as like I look at my readings and sometimes I'll take note of them a bit more than others, depending on how I'm feeling. But do people know what it feels like to feel good? To actually feel like what feeling good for a period of time, to then have alcohol, a few beers or whatever it is, to then feel like I'm actually at 50% for a while. And I would argue like so many people are running around feeling at 50% function, 50%, should we even use the word optimization, or 50% performance, until we get to even 70, 80%, then how do you know how good you can feel? Because I've felt really bad in days when I've been overweight, ate a lot of junk food, loads of insulin resistance going on, really bad sleep, all these things. And then I start to feel better. And beforehand, I thought I could get away with getting a takeaway. I thought I could get away with a few beers. And in theory, I could, because I felt crap.
Your baseline is essentially very
Baseline's so low,
and
right?
You know no different as well,
Yeah.
right? So it's kind of contrast is kind of what's there. I think also, I mean, we spoke on this on the last one, but I think also important thing to consider is also age as well, right? So what you could do, what could any of us probably do or allow in our 20s, health-wise, or the opposite of, you're more resilient, for want of a better word, in many aspects, not only physical health, but even mental health and other things. And what your body can tolerate or cope with in your 30s, 40s and beyond. And maybe testosterone has a part to play for sure, but let's not just put it all in there. Just general baseline health. I mean, that's, paramount. I think a lot of people do kind of neglect that and actually say, well, yes, you're comparing essentially apples with oranges, right? Trying to compare your health now, aged 48, versus what it might have been when you were 25 or 26, different stage of life, different responsibilities, maybe not having young kids and reckless sleep and all sorts of things. I think it's not it's not comparable.
Yeah, I think it is interesting, like the amount of health data we have access to now really easily, but we're kind of missing the filter to understand how to use it. I think if we go a couple of years back, probably just as GLP-1s are breaking through, like there was this crazy thing for like glucose monitors, right? Everyone was wearing a glucose monitor. Yeah. And if you look at that, I see people in my gym and I'm like, oh, I get, if you were diabetic or borderline diabetic, it's very important. I guess if you wanted to see your tolerance to certain foods and whether that causes an insulin spike or not, maybe. But people are wearing them for the long term. I even have people going to me going, oh yeah, I've read like if I do 20 bodyweight squats before I eat, that will help lower my insulin response. I'm like, but why do you want to lower your insulin response? Like, what is it a problem?
And also, are you chasing short fixed numbers without the longer term?
And there was kind of no understanding. I think this is a lot with the health data. We're bombarded by it, but we don't really have the understanding to filter it and understand what it means, or actually what we're looking for at the end of it. It's kind of like, well, if you want to do 20 squats in a restaurant before you have lunch, I mean, knock yourself out. But what's your goal with that? Is it about lowering your insulin response, or are you thinking that's going to improve your health in some way in the long term? Or is your goal to lower body? And then they're also like, well, I don't really know. I'm like, well, then why are you doing it? Because it actually is not really making a difference.
Yeah,
They're a good tool, right? But just that, a tool. And I use them with clients occasionally, not every client, but if someone hasn't got an awareness, it's a glucose monitor as well, right? It's not an insulin monitor. So it's your glucose going up and down. And they're like, why is my glucose going up and down when I exercise? So because you need
biology,
energy,
right?
You need glucose, you need sugar, you need energy to be released from storage sites so you can utilize it, quick energy. And people start to see that. But also when they then have certain foods and it's spiking up a lot and not coming down, that's where I would say it's a good tool. But they're not cheap. They're like 60, 70 pounds for 2 weeks. You put them on. I've seen people then, because it would, like when I look at the clinic side of things where you're registered and you see when people scan it, people are scanning like 200-300 times a day. I'm like, what's going on? Like you're scanning it every 5 minutes, just let it be and look at it back, track your food and look at it. and we can see what we need to do, but you don't need to wear it week in, week out. I had one guy and he had the money to do it, and he was literally getting them back to back. He had a year or so worth of data, and I'm just thinking, why do you need this amount of data? Because it's missing the wood for the trees, right? Well, how do you actually feel? And it's the same with auras, it's the same with whoops. They'll give you these scores.
Yeah.
It's good to keep an eye on them, but do we then lose the ability to actually check in with our body and see how we feel?
Yeah.
And it's interesting because social media often drives behavior as well, right? So with the glucose in particular, it's something like the vilification of insulin spikes. And something was like, oh no, insulin spiking, oh, it's bad. It's like, no, it's meant to like fluctuate up and down.
We were speaking about prevention earlier, and that's a big topic. But I think, I mean, my view on this is, I mean, I take a sort of middle of the road approach, having explored a lot of it, but coming from all angles, with my clinical hat on and working the NHS and seeing what, colleagues and others say there. And that can sometimes be, sorry to say, but that's very one-sided. I think there are some slightly more old-fashioned views on the use of wearables and consumer-centric behaviors and working with the private sector and, wanting to optimize testosterone, for example, wanting to take supplements. Let's, peptides or not, let's just park that to one side, but we'll dig into that. But so I think there is this kind of ongoing conflict in 2026 and probably for the last decade or so, but I think it's brewing, and I don't know where it is in its kind of inflection point, but we are a place where paternalistic medicine, so 30 years ago people used to listen to somebody who wore a white coat, and the doctor would say, do as I say, not as I do as well. Doctors necessarily didn't practice maybe the best medicine themselves, personally. Then we're all guilty of that. Hostile culture perhaps was, working 80 hours or 100 hours possibly contributed. But we're moving away to now people wanting to be empowered. We have an overwhelming amount of information, whether it's the right source or not. Social media is a big channel of it. Influencers, so authority bias coming in, some of them with white coats, some of them not, some of them fake doctors. There's fake AI doctors out there.
Dr. Dre.
Dr. Dre, not medically qualified, but producing some good hip hop beats, let's say. And then you've got kind of products, okay? And products are now coming from consumer brands, so startups, scale-ups there, but you've also got medical device companies. So let's use CGMs, so continuous glucose monitors. So as a topic you both mentioned. So I did try one for a while. I actually managed to get one for free. So it was the Lingo device, which was a consumer-centric version of the Dexcom, which is actually used for diabetics. But interestingly, it was manufactured by the same medical device company, Abbott. So Abbott suddenly sensed that they were seeing demand in sales for what is actually only meant to be for diabetics, that they suddenly realized, well, hang on a second, we should probably create a separate product for that, which essentially uses the same underlying tech. So the tech is the same, but it had a nice app around it, and it was designed for a 2-week course. So you would
like the Freestyle Libre.
Correct, the Freestyle Libre, yeah. And you would, purchase it for probably around £200, I think, for 2 weeks. You would get your insights, and then you would have 2 weeks of sort of coaching or behavior and nudges. And then after that, that's where it's meant to stop. And it's the premise is it would hopefully make you firstly more aware, and then you could do something about it. So turning insights into action, or that's the hope. And I think the success of that is debatable. I think there was a time when Freestyle Libre itself was actually on advertising. So it was on TfL bus ads and things like that. And he started thinking, okay, but they've also got the Lingo, which is meant to be the consumer brand. Why are they advertising the diabetic monitor? What's really going on here? Are they just responding to demand and just seeing it as an opportunity to make money? Because at the time, apart from kind of insight, this is just pushed down to the consumer. And as we all know, in the population, we have huge disparity, right? You might have healthcare professionals like myself. You might have people like yourself as well, Ollie, who are hugely knowledgeable, right? Have done years of education, training, lived experience, working with patients, clients, etc., to know a little bit about this and make informed decisions, and this is on yourself, so it's your consent. But you have a ton of people who don't have the health literacy, are sadly being manipulated by influencers and other sources, and are then left feeling very confused and very vulnerable. So suddenly they see an ad, they see they must have that. Someone else is saying this, someone else is saying something else. They don't really know which one to trust. That causes a lot of indecision and confusion. That creates their stress and cortisol goes through the roof, probably makes it even worse, right? So it becomes a vicious cycle. And I think we are seeing a trend now where, and we can talk about some of these wearable companies actually we're incorporating labs in the US. So blood biomarkers are coming into Whoop in the US. We see Aura is also partnering as well with, I think, Counsel Health, which is basically a GP practice, so a primary care telemedicine service which leverages AI in the US.
Did I see Whoop also have an upgrade where it's actually medical grade? I think it's blood pressure, I want to say. Or was it
yes,
like ECG?
debatable. Yeah.
It advertised it as medical grade.
Yeah, they did do that, but they had a bit of a slap on the wrist from the FDA.
Okay.
They didn't quite go down the medical device pathway, although they could have. But you're not wrong. We're at this stage now where these companies are becoming really huge, right? So Aura is literally as of 3 days ago filing to go public. So they're going to hopefully IPO at some point, which raises capital, raises awareness. That means they go bigger and better and faster. And I think they're already at a stage now where a lot of people are aware of them, they're using them. There's a huge wealth of data. So comparing Aura now in 2026 and the insights that could be learned from there and translated into actual health actions through their partnerships, for example, which I just mentioned, versus when I first learned about Aura, just about 2018 or 2019. It was only a few kind of celebrities, entrepreneurs. It was very expensive. It was kind of a bit niche.
Yeah.
It definitely was very niche then. So
you didn't have a subscription then either. I remember buying an Aura 2 and there was no subscription. I was like, I bought this and I can actually use it. And Aura 3 came along. You're like, oh, now I have to pay £7 a month. And the same with Aura 4. And ironically as well, like I bought a Aura 4 secondhand because I needed one which was a little bit smaller. And the battery was going. So I went on customer services on the app and I was like, look, I've had this for a while. I don't know how old it is. They're like, oh, we'll just send you a new one. So this is a brand new one. It's still an Aura 4. However, I didn't have the app live or anything. And I was quite frankly, I wouldn't really care because like it was just a wedding ring essentially. It'd been about 2 months since I'd last tracked anything. So it is live now. So I'm like, well, I've got a new one. I might as well use it for a couple of months.
And has it changed your habits and your daily
to be fair, like, it hasn't changed my habits at all. And even things where, so you got Garmin tracking your sleep, you got Aura tracking your sleep. You might have an Apple Watch, you might have a Samsung, whatever it is. They track it differently.
Yeah, of course they do.
And like the amount of times you see like micro awakenings on your Aura compared to your Garmin, and a lot of times people are going to go with the one which makes them look better.
Of course. Yeah.
So like if you have 4 different, I bet if I had a Whoop on this arm or whatever it is, and you've done a sleep study, they would all show different things.
100%. Yeah. And then I think to be able to take that, maybe that's if you do your own personal trial, you will have a preference, okay? Mm-hmm. But that's somewhat biased, right? Because that's what's worked for you. That's not necessarily taking into account, say, a client of yours who might have a different genetic profile, different medical history, different comfort level as well, right? If they have an incorrect sized ring, for example, if they don't tolerate something. And then, bringing it back to sort of traditional healthcare medicine, we're in this age now where we don't really know how to interpret the home monitoring of this, which I argue is probably better because you're having people who are in their own environment, probably without the stress of clinicians and doctors running around, versus, where the data is for, say, sleep studies traditionally where you went into a physical location, a sleep center, you stayed in overnight, not in your comfort zone, very stressful institution, it's just not going to be comparable in quite the same way. But we need to have that data as well. We need to understand it. So I think coming back to what I was saying a bit earlier, where clinicians may say, you will hear professors and others be quoted in lots of places saying, this isn't indicated or this isn't licensed or the data suggests. And the data suggests based on obviously studies which were done in a very different time. And it's not to say that studies won't happen. I think there are still to be done with these consumer wearables, for example, or supplements, for example. But I think that does need to happen. The difficulty is, let's take supplements or peptides, that pharma can't patent these in many cases. And therefore, there really isn't the financial incentive to go down the full trajectory of doing a clinical trial. And that's a very contentious point, unfortunately. But that means that we will hit this kind of wall where ultimately you don't get that same level of clinical grade data because of that. What's your thoughts on that, James?
Well, it's interesting that the whole wearables. I mean, my own experience was years ago, I got a Whoop strap because I thought, I'm interested. And maybe I'm not the target market, but I was noticing that the only effect on my behavior, I was exercising regularly, I've had mainly a healthy diet, but it was the sleep became a real thing for me. I would wake up in the morning like, how was my sleep? And if it said you've had bad sleep, I'd be like, even if I felt all right. And I thought, well, that's really interesting. I'm letting a device tell me how emotionally I should be feeling through the day, which was like a kind of leap I made. So yeah, I abandoned it because I thought, you know what, I kind of know myself whether I've had a good night's sleep or not, where my energy levels and all the rest of it. So, and I think this is a problem. Like you say, the devices are all giving slightly different data. They're measuring it in different ways. I think there are people that probably do go for a multitude of devices at the same time, and then they get overwhelmed with the data. And I think there are clear benefits, like you say, being in home environment, that data is going to be more reliable if you're not in a clinical setting where, you're going to be thrown off by external factors. But then how do medical professionals access that home data? How is it utilized? And down the line, I think it's a big question, like, how is this data going to end up being used as well? So then we're kind of overspilling into kind of the privacy issues as well around it.
Huge amount. I think it's going to converge. I think it's going to happen. You'll start seeing. So I used to do a bit of work in clinical trials, and that was on site. And then there was the concept of decentralized clinical trials, so enabling people to do stuff at home. And wearables definitely come into it. You want to capture lots of different bits of information for which the best product may be a wearable.
How do we regulate that stuff at home though? Yeah. Because like blood pressure monitors,
it's complicated.
Like you have to put the blood pressure monitor at the right place, have the arrow at the right place, sit down for a certain amount of time. And in a clinic, people get white coat syndrome.
Of course.
So again, like that can hit blood pressure, it can hit your resting heart rate. So there should be more consistency at home. But if they've not put the cuff on right, and we can get 24/7 heart rate, blood pressure monitors. I haven't looked into them in depth or anything, but how accurate are they? And again, are they causing more stress when people go to look at them? And even with blood pressure, like I've got a cuff at home, I'll monitor it a few times a month just to see where I am, just out of interest of it. And you can really like take it straight away and it's a few points higher and then lower. And then people also get really stressed because they're not at like 120/80. They're like 131. And like actually context of your fitness matters as well. And it's causing a lot of stress. I love having the data, but as you say, we get obsessed with it. What do we do with the data afterwards? And even things such as heart rate variability, I think is a really important marker when we look at overall stress on the body. And the lower it is, the more stressed in theory we are. And I'd want to see it ideally over 40, ideally over 60 for most people. But when you look at the actual tech, a lot of them are actually saying your heart rate variability is balanced, which we want it steady, but it's balanced at rock bottom. So you're ridiculously stressed and you've been stressed for a long period of time. So there's nothing wrong with my HRV. Actually, we want to get it up. If we double your HRV from 10 to 20, you're going to feel drastically better. We go from 20 to 40, you're going to feel even better again. But this tech is telling them in a lot of cases that it's not a problem because it's balanced. So this is where context comes into it, right?
Yeah, I do think we're at an inflection point with this because I think we will see quite rapid change because I think AI is giving us the ability to sift huge amounts of data in split seconds. And I think, hopefully, we were talking about this before we went on air. Like, I think this does give the foundation for a shift towards a more preventative model of medicine. One of the big criticisms we have with the current medical system is like it treats the symptom after the fact. It's like, oh, yeah, I've got the disease now try and fix it. Well, how do we have the conversation about let's not get the disease in the first place? And having this data in advance can obviously help you make the lifestyle adjustments and start to go down that preventative path. I don't know how long that will take. And we talked about the political will investment to achieve that as well.
Yeah, that's a whole other topic.
But I think there's encouraging green shoot signs there of what potentially we can do with this data and start to try and nudge people towards behavior change for a more preventative health model than we currently have.
Yeah, totally concur. I mean, I think the key thing is that it can, right? It's not, it definitely will. This is still very early and we're still figuring out exactly how this all fits in. But I think, look, over the next few years, it's a very interesting time with AI and other things. I think we're going to see rapid developments, and we are definitely at some point coming towards an inflection point, hopefully for the better. That's kind of wearables, that's kind of data, that's, consumer tech, and that's just broadly in society. Keen to obviously understand with both you fellas as well as myself, what this means for men's health. I guess where do we extrapolate those insights, and what are the kind of latest trends? So maybe over to you, James, on that. So a lot of the work that you may do with clients that come to you, and what would you say you're starting to see with men, and maybe how does that contrast to what you see with women?
Yeah, well, actually, it's interesting, Johnny. Like, I specialize with midlife clients, and often questions are the same, which I think midlife is that point where we do naturally take stock. We become aware of our own mortality, perhaps. Maybe there's an event that triggers that. But what I see is people who are successful on paper, right? They're like, oh yeah, I've made it. Like, I've done it, but yet my life feels empty. I'm not fulfilled. I feel kind of flat and empty. And we know there's a lot of reasons for that. We can talk about, the testosterone for men, but women do experience it as well. And I think what it generally boils down to for most people is they've just drifted out of alignment with their values. So I would say when we're younger, we're often quite informed, we're quite aware of what our values are, and they determine the path we'll take through life. It's like, well, I really value this thing, so I'm going to upskill it, and then that's going to inform my career. But of course, over time, with experience, our values change. We go in relationships, they might change our value systems, but we don't check back in. So often, where we've ended up is a direct result of the course we start out on, like 20 to 30 years before. And it's hardly surprising that having got there, we're like, wow, it's just not what I thought it would be. Because our sense of identity has shifted along the way, but we haven't checked back in with it. So a lot of the work I do is kind of like, well, why do you think you feel disconnected now? When was the last time you looked at your values? If we map your values, what are they now compared to when you were younger? And then, like, what's the identity you want? Because, like, where you've got to now is the sum part of everything you've done so far. That's the identity that's got you to here. But midlife is an amazing opportunity to step into the next thing. Like, typical thing is a lot of people have children leaving home, perhaps. There's a shift in career. Maybe they're retiring. Maybe there's redundancy. I'm like, what comes next? We've got much longer lifespans. We've got better health spans. So what do you want to do?
Hopefully.
Hopefully.
We'll speak about that.
Yeah, there is some data saying that our health spans actually deteriorate.
The ONS data recently.
Yeah. But it's a big opportunity. But you might need to step into a new version of yourself to get there. And as humans, we're not very good at that, right? We're very good at running on autopilot. So we think we're leading our lives. But actually, because we're exposed to so much stimuli all the time, we're just like flipping into autopilot. We react to what's in front of us. So I'm like, okay, well, what if we stopped reacting? What if we pause and think about who is the person that I want to be 10, 20 years down the line? How would they choose to act consciously rather than reacting? And bring that back down to like small everyday things. I always say, like, play it forward. When you're at a decision point, it's like, well, not what's going to make me happy now, what's going to give you that dopamine hit now. What would that future self thank you for doing? What are the actions you can take now to move you towards that goal? So that's a lot of work I do, I guess, on the psychology side. But because I believe in a holistic approach as well, and I think this is another thing that's not really recognized in Western medicine. Like, if you're not looking after your body and your physical health, of course, you're more likely to struggle psychologically as well, and mentally, because if you're, and this is most of the time, like, people want to fix the mental side. It's like, oh, well, I get up and I do affirmations. And it's like, well, that's great. But you're also sitting in your house all day on the sofa eating takeaways. So no wonder, like, you're not feeling uplifted. And this is the thing, like, recognizing we're holistic beings. And so we have to be in physically good health. We have to be in mentally good health. And I think, again, we're very used to the idea of working on physical health, right? People are like, we get it. It's like, oh, if I want to be leaner, if I want to put on more muscle, I've got to go to the gym and train. I should eat a healthier diet. What we're not so good at is recognizing that we need to train our minds as well. We get less neuroplasticity as we age. And there's more and more research coming out that's showing, like, exercise actually helps reduce brain issues like Alzheimer's and dementia. So I always say to people, like, okay, what are you doing for your psychological health? Like, we know as we age, we get more risk averse. Our subconscious role is to keep us safe. So we turn inward, we start catastrophizing. Knowing that that's happening as part of the aging process, what do we want to do to counteract that? So we stay positive, we stay open to possibility, we're curious, and we get out there. So that's sort of work I do with my clients, kind of understanding that psychological piece. And then I don't prescribe them exercise or I give them work. I'm like, look, you need to be moving your body. You need to understand general nutritional principles so you can make informed choices about what you're eating. You know, I use this typical case with females that go on HRT. They're like, oh, I've gone on the HRT and nothing's changed. I'm like, well, let me talk me through your day. And it's like, well, yeah, I drink a bottle of wine every 2 days. I get a takeaway 4 times a week. I don't do any exercise. It's like, well, that's why your HRT hasn't improved your mood.
Problem is, though, society's normalized that, right? That's the norm. You're the outlier if you are healthy.
Yeah.
And they're saying that's healthy. You're obsessed if you're actually doing the healthy stuff.
And I think this is a big challenge for all of us, right? So I had a great conversation. I don't know if you know Dr. Max Pemberton, Dr. Courtney Raspin, and they've put out a great book about the psychological work you should be doing with GLP-1s. Because, of course, we all know you take a GLP-1, your appetite goes, you lose weight. Great. But what's the underlying reason that you are overeating in the first place? What's the reason you're chasing that dopamine hit of 8? What's your relationship with food? And yeah, jab yourself for 2 years. If you haven't done that work, as soon as you stop, the weight's just going to come back and then you're back on the GLP-1s again. So, but it's how do we drive that change to, I guess, kind of educate people and entice them to do the work? So I'm always like, essentially boils down to lots of complex factors. But one of the key ones is discipline. Discipline is just not sexy, is it? You can't sell discipline. It's tough. But I always say...
And self-discipline as
self-discipline.
well. Right?
But that is the one thing that will make the biggest change to your life in any area. You want to be financially successful, learn financial discipline. You want to be physically amazing, learn physical discipline. You want to be psychologically smart, learn psychological discipline. But it's not sexy to say, oh, do this thing every day and over time you'll get there. But that is the secret sauce for pretty much everything.
So maybe it's our society we've given people optionality. So maybe there was something in the paternalistic model of medicine that actually being told what to do in some cases, and I'm not saying this is actually the case, but in some cases might have actually been beneficial because people would actually listen and hopefully do something. Now, again, if it's driven by fear, that's not a good thing because there's stress and anxiety and things like that. But I think now we've got optionality and that's causing stress and confusion, and people are also then, because of that confusion, they're probably doing nothing, right?
Yeah.
And they're becoming lazy, and it's just easier to not do something as well. What is your take on that, Ollie?
It's interesting with the reflection and the self-love bit, right? And I've put out a few posts recently about we look in the mirror and we don't always recognize that man that's staring back at us. But recently, as we said in the last podcast, I turned 40, the big 40. I'm now my target demographic. But I reflected back on going into my 30s, and I just got married, but I'd literally just done a video shoot as well with Eddie Hall, like a few weeks before. I was working with pro athletes and going into the Rio Olympics. It was awesome with performance nutrition. But even the stresses I have now, I look back and I was like, I would have loved those stresses. You think about how far you've come in that decade of like literally working with multiple celebrities. One of the guys that I've said about is like literally one of the guys would have been one of the people I idolized at the time. I've become a Christian and like all this stuff. And we go into the mental and the spiritual health, which is so powerful. And it's interesting we talk about, like you said, about the going on HRT and not seeing the results. I'm going to say this from a Christian side of things. I can't remember if I've said it on the podcast, but I was running with our pastor the other day, and it came up about Christians and sins and how we pick and choose the sins that we follow and we hide. And it came to us that gluttony, it doesn't say it in the Bible that gluttony is a sin. We've said it before, like gluttony is a sin. Why do we have so many overweight Christians? Gluttony is a sin. Like, why are we not loving ourselves enough? It says in the Bible to love your neighbor as you love yourself. Most people don't love themselves enough to, I would not want some people to love me like they're loving themselves. And we have to look deeper into this stuff. And then as well, getting onto the GLP aspect, we are seeing a lot of research that comes out now about anhedonia, the ability to feel pleasure because of the impact on dopamine receptors. So people that are on GLPs for a longer period of time, It's like when we look at like, is it semaglutide, terzopeptide, or retatrutide, or there's mazdutide coming out. There's other ones coming out more on like the Ozempic, the semaglutide side of things, but they're still coming on the Mounjaro, the terzepatide, and the retatrutide.
Not to everybody though.
Not to everyone, no. But it's still, people are just feeling numb on those, and then they're worried about it. But then further down the line, are people then checking their hormones at the same time? And again, we look into same with the feeling good that we said about earlier in the podcast, where a lot of people don't know what it's like to feel good. And then we look back. I've worked with clients that have had Mounjaro multiple times. We look at people with autoimmune conditions and all this stuff, and we forget to realize that what we fuel our body with impact how we feel. Food is just fuel. It is what it is. It's fuel for our body. Not to say we don't enjoy food. Everyone will go through emotional eating. We do it when we celebrate, right? We eat different stuff.
Society, really.
Yeah, it's that we have like social events where it's around food. So it's not to say stop enjoying them, but food is simply fuel. And when we start to recognize that, we can realize that when we eat a certain way, it may dictate how we feel the next day. If you are okay with feeling a little bit worse the next day, bloated or something like that, then have that food. If you've got a public speaking event coming up or something where you've got to be 100% on point, don't have that food. That's where some of the self-love and discipline comes in, right? I talk to my mum about, she's like, what can I do about arthritis and this rheumatoid arthritis and like all this stuff? I'm feeling bloated all the time. I'm like, stop having gluten for starters. When we look at the research with any autoimmune condition and gluten, there's a massive crossover. But I don't want to do that. We don't want to improve. You don't want to get better. And people will also pick and choose the stuff and the advice they take. There's a guy that came to me and shared a lot of messages together. I won't go into the depth of it, but he was saying about like post-finasteride syndrome.
Okay.
So PFS, when people are taking finasteride and then it's not something we can actually diagnose on bloods, but people are having very low moods and depression afterwards and horrible feelings. And it's ironic when we talk about the hair transplant side of things, but like when we talk about post-finasteride syndrome, it's a horrible thing for people to have. It's not saying everyone will get it, no. But he's been through.
It can be for a small select few. It can be
horrible.
Yeah.
And
fatal. Right?
Yeah, people have committed suicide with it, and it's do we know what can improve it? And this guy's been through specialist to specialist to specialist. He's speaking to me as well. And he said, this person said it's not PFS. This person said it's not PFS. And I'm like, that guy I completely trust. That other doctor I completely trust. That person I trust. If they're saying it's not PFS and it's something else. And he then sent his bloods through to me. His testosterone was sky high. And he said, I was on like 100, 120 milligrams of testosterone a week, but I didn't feel as good on then. So I stopped what the doctor said and put up to 150. So actually it was that high and you put it up. I said, look, I can work with you, but I'm not going to work with you with testosterone that high. You need to bring it down. You're self-medicating. So if you're going to do that, you need to bring it down. We need to do bloods. And he said, I've been on way higher and I've not felt anxious. I said, you're blaming this on one thing and you are literally searching from specialist to specialist to specialist to specialist until they give you the answer you want.
So shopping around essentially, right?
And a lot of times we can go into AI to find this answer. Now, I bet you if you've used ChatGPT for a few months, you've used ChatGPT for a few months, I've used ChatGPT for 3 months. If we put a blood report in all three of our ChatGPTs, we would get different responses.
Which I don't recommend doing for the record.
No, but like you would get different responses. And people are doing that. And it's going to be biased based on, unless we're always using the private side of things, it's still going to be biased on the information we've input into it, what it's learned about us. Mm-hmm. And I do find that a little bit worrying, not saying it as a professional in the industry of someone who does coach people through this stuff and reads bloods day in, day out. It's a case of, it's scary to see how much people are trusting AI, spending a lot of money on supplements without doing those foundations, when actually we need that discipline and we need the accountability. As I said to you before we started here, is that AI isn't keeping me accountable. AI isn't going on a call with me. We can have amazing chats with AI. Sometimes I do have a like backwards and forwards chat with ChatGPT. It's crazy and scary, but it's not keeping me accountable. Even on those times when I say to it, send me a notification to do this, swipe that notification away. There's a difference with human accountability, I feel.
two quick things, and definitely love to. But I mean, I think that's what you're talking about, which I think is a big problem out there, and it's not being tackled well. Certainly in places like the US. I think a little bit better in the UK, so we don't have, because of the EU AI Act, we don't have ChatGPT for Health, which is a standalone product in the US, and other large language model frontier AI companies have their equivalent. Perplexity and others also do have that, but you still have people putting their own data. And what you find is when there are a breed of health tech companies that are going down the hard route of going down regulated device status, but that takes years, and and it's not a quick, easy thing. So these companies essentially which have the headlines and the awareness, so everyone knows ChatGPT. Not everyone will know various niche products that aren't having the marketing budget to go after the regular everyday person. So these are getting used, and of course these models are biased, and there is a bunch of things which we won't go into the nuance of AI, but why it's not good or safe. Now, in many cases, it could be helpful and could be factually
Not
correct.
all the time it's going to be wrong. It could be.
But that's one thing. Then you've got the second side, which is large language models in particular have a very good skill of being able to almost develop a parasocial relationship where people are now bonding with AI tools and large language models and bots out of that in a way that you didn't with a search engine such as Google. You put in a question, it comes out and it just throws rankings of pages, and then you go on to that. So a lot of people still do trust Google as the #1 search engine, but large language models are accelerating that. And I've read cases, I don't think I've spoken on this podcast, where things I've seen on LinkedIn where physicians in the US seeing 70-year-olds come in to A&E, worried they have a particular blood disorder, a high phosphate level or something it might have been, requesting or demanding for a particular test because a large language model, maybe ChatGPT or others, has convinced them that they might be at risk of poisoning and they need to go to the ER immediately, after the physician counseled this patient for however long to convince them that no, it's not that, and done a bunch of other tests and ruled anything dangerous out. This person goes home, okay, reassured that they're spoken to a human, 3 days later comes back. Why? Because non-stop, when that small doubt is in the mind, a particular AI tool could convince them otherwise, right? And that's the risk. So what I do see, there is a space, and I'm sure there are a lot of different products out there that are going down the route for therapy. So there are kind of, large language model tools that are going down a regulated route to support people. But it is, the trouble is, it's a bit of a Wild West, right? Because do you have to go down a regulated route, or are you going to just launch a consumer product and say it's for research or educational or informational purposes? And I think many have done that route before. And regulators are struggling. How do you clamp down on these things? What's your take as someone who is doing the human element of therapy and coaching?
I'm already seeing it, like anecdotally, people kind of having like a therapist-client relationship with their AI model. And it can be useful. Some people, we know we're living in a loneliness epidemic. People are getting their sense of connection from that, but I argue that's not healthy, because at the end of the day, it's not a real person. And as we know, like, the language models aren't infallible; they make mistakes. I mean, I was one recently. I saw like a court case in High Court, and very, very good London firm, and the judge was like, "Well, the case law you've cited is actually made up," and they'd used AI and it hallucinated case law. And this can happen in therapy. And, there have been tragic cases already that we know of, that there are lawsuits pending where people are suing these large language models because people have tragically taken their lives off the back of the advice they've given. I mean, I think we'll get there. I think what we're missing at the moment is like the Wild West, and we have to remember that we're at the very start of it. And I think everyone's trying to figure it out. But we need to accelerate how we figure out what's a responsible way to use it. Like, where can it be used to systemize, to do that early filtering, perhaps, but then we hand over to a human. Like, I'm sure you want that in like, if you're sitting in casualty and you're waiting someone, you've got the whole triage thing first. But if a language model could do all that, so when the person sat in front of you, with like 99%, like, this is what's wrong with them, that's saving you a massive amount of time, right? You can just treat. But we're not there yet. There's a model. Sorry, I cut you off there. That's all right.
Functional Mind. Have you seen Functional Mind.ai?
Not that.
It's aimed at practitioners, specifically for medical.
Okay.
But it will not give you a protocol. It makes you think. It's about like $90, $100 a month. So it's not based on like the general ChatGPT side of things, but it's built specifically. It's got hundreds upon hundreds of thousands of studies been fed into it. They're constantly updating things, and it will nudge you to do the work. And I think we can even get lazy as practitioners, as doctors, as clinicians, that we rely on AI too much. And we forget about the need for the human connection, as we said about that, and also building up that timeline of the story. You said about the psychological aspect, I believe it was like from the start of, we've been on this earth. I've been on this earth for 40 years. My health is a makeup of 40 years, and then we could go back transgenerationally and everything else. But it's a makeup of the 40 years I've been on here. Trauma in childhood, going through different things in teenage years, in adulthood, all dictates where I am now. And when you go backwards, and it's hard, we've said about with NHS, with GPs on NHS, is that when they've got 7 to 10 minutes or whatever as a target, you're not going to get much of a backstory. If I had 10 minutes with someone, we're not going to get very far. But people are chucking in their data with ChatGPT, and they haven't given them all the details beforehand. So are they going to get an actual contextual answer back from it? Most of the time, not. They might, like, one time get a really good answer and it actually works for them. But most of the time, it's going to need a lot more context.
Yeah. It's the same with coaching. You know, you're building up a relationship with a client over a period of months, and they're volunteering more and more information, but it's the nuances in that information. And they're like, oh, you just said that. Can we reflect on that? What's that mean? And like an AI model isn't going to pick that up.
Yeah, it's several kind of good points to just blend into one. I mean, I think over time that they will actually get that data. You know, they will longitudinally build up a record base, depending on, you know, context windows and storing and stuff, that actually they probably could actually know someone better. Just like, I mean, you know, we all use smartphones, but, you know, a decade ago that was a bit of a luxury. And now, how many times does your smartphone actually predict when you might want to take away, or how, just based on where you're walking, that you might be traveling somewhere because it's a particular time of the day and week that you might be going to a child's swimming class or wherever it might be, and it's going to take you 16 minutes to get there, and it tells you the traffic and it predicts that, and it's you know, it's easy to fall into a bias or a trap that you trust it because it's so, you know, when you trust it on 80 or 90%, why do you not trust it the whole way? And there's that 5, 10, 20% margin of error, which I think is very hard to eliminate. And I think, you know, these things the trajectories, they would get better. They refine, they get better, it gets safer. But I think we're in this kind of dangerous middle ground.
Yeah. What I perceive is there is this drive from the AI companies to like how can we remove humans from the equation? Like everything will be much more efficient and much more accurate if it's all machine led. And I'm not disputing that it could be more accurate, but comes back to your point, are we creating even more of a spiritual void in our lives? And I'd argue like a lot of the issues we see in modern society are due to a lack of spirituality, you know, and guidance. And if we hand everything over to machines, are we gonna only increase that and worsen what's going on in terms of our spiritual looking?
You're opening a big can of worms there. But that topic, I mean, just really to summarize it very quickly, is, you know, the trajectory that in a couple of years' time there were predictions that AI is going to take over significant percentage of jobs in the workforce. That means lots of people are unemployed. Globally, that leads to many people needing to be supported. So you've got universal basic income to support all those people. How is that funded? It's probably funded by 5 or 10 of the richest and biggest companies in the world, which are AI companies. And it's a bit of a vicious cycle. And then what do we do with all this time, right? So maybe we become more human and we spend time, you know, doing human things, spending time in nature, socially, we connect, we find, you know, spirituality and purpose and all of this. Maybe that's one version of it. Maybe we just lose hope, you know, and it's actually that learned helplessness model where you're on that kind of treadmill and your life is being fed to you. You're being funded by an entity or source of government, and that whole thing goes. But now certain big AI companies are saying actually they were wrong in that prediction, and maybe that's because some of these are going to go public, and there's that whole thing. But I think so that was a very quick whistle stop tour, because I think you're opening the big can of worms. I wanted to jump back to something you said again before we started recording, which was more about in the workplace.
Yeah.
I mean, maybe it's data on men and women or just men. And you said how things are now in 2026 versus what it was even a few years ago.
Yeah.
And I'm just keen to pick up that conversation.
Yeah, I mean, I've spoken to a lot of people in leadership positions, and the common theme is just like the rate of change feels relentless. Even where that's being driven from, it's often by kind of committee. And there's a kind of feeling that tech is moving so fast at the moment. I mean, like every day there's a new advance. It's like, how do we adopt and use that to give us our competitive advantage? But it's almost putting the cart before the horse. It's like, let's get the tech and install it without thinking, well, actually, hold on, what's our business goal? How is that going to help towards our business goal? It's like, we've just got to have this shiny new toy and plug it in. And that's making people, I think, feel very uncertain in a kind of way. It's, I guess we go back to like COVID times, right? When we had that unprecedented uncertainty in the world, like, wow, everything's shut down. We don't know where we stand. We saw like levels of anxiety went through the roof. We're still seeing the fallout from that now. We were talking about that earlier. And I think it's interesting. I was talking about this resilience 2.0, because I think what we're going to have to get better at as human beings is living in this liminal zone of more uncertainty a lot better than we do. So humans, this is psychology. Humans love the perception of certainty. We want to think like every day, despite how adventurous we might think we are, we like every day to feel the same. We know we get up in the morning and like the house looks the same. There's that same thing on TV. My journey is the same. That's how we are wired. And it's an evolutionary thing. Like if we were safe in our cave before we went out hunting and nothing's changed, we're like, okay, everything's hunky dory. What we're really bad at is living in uncertainty. It's like, oh, I've woken up today and I don't know everything looks different. I don't know what's going to happen. But we've got to find that trust in the uncertainty and get more comfortable with living in it. And there's a couple of ways we can do that. One is to like create that perception of certainty ourselves. And it is only a perception, because nothing in life is certain, of course. But like have routines that you lean into. It's like, okay, control the controllables. Like, what can I do? Do I start my day in the same way? Is it I get up and I do my affirmations? Do I go into prayer? Do I do my exercise routine? Have those structures through the day that give you the certainty, a support system. Yeah. And the other thing you can do, of course, is, and I think this is where it gets quite interesting, whether AI and tech is going to drive into increased spirituality. Do I lean in something that is bigger than myself? Do I put my trust in God, in another, being, the universe, whatever you want to call it? And that takes some of that anxiety away. You're like, well, everything's uncertain, but I'm very certain in this thing. And so it's kind of like a reawakening of faith. And I think that's like a really interesting phenomenon, because we're certainly seeing, I think, increase across the board in all faiths, certainly in Christianity at the moment in Western society.
After for years or decades that had all dwindled.
Yeah. But particularly, as the data says, it's young men are going back to Christianity. And what's really interesting, particularly to Catholicism, which is, again, you think that's kind of counterintuitive because they have more strictures and controls than, say, the Anglican or evangelical approaches. But maybe these young men are looking for something like, okay, there are a certain like set of rules that I live by and I'm governed by, and I can put my faith in this higher being, and there's a hierarchical structure and there's people I can go to for advice. So it's interesting. I think that it's occurring. I think it's a really good thing it's occurring as well, because I do think there has been this spiritual void for a long time since the Industrial Revolution came along and ripped up communities and took away that sense of community and cohesion that many people have.
Support and things like that. See, when you began that, I was going to almost counter it immediately, because I think that my view is that actually humans do thrive a little bit in uncertainty, in that we get bored. And I think, we are prone to boredom. And I think we're more prone to boredom in a world where we're constantly overstimulated, because we have optionality and it's chasing dopamine and it's that sort of thing. And I think there is a certain type of human, and maybe many of us here are, because that's why we go out and do things, because we're constantly curious and we want to learn and challenge and learn. And that's, so we almost feed off a little bit of and the stress keeps you, and maybe it's running away from fear, but keeps you going rather than falling into the trap of complacement and comfort and things like that. But on your second point, I'd love to hear your views here, Ollie, and bringing it back to kind of men's health. Yes, the mental side of it, even the physical side of things. We spoke about the loneliness epidemic. We spoke about parasocial relationships with AI. And, funnily enough, I heard about, I think can't remember exactly where in Asia there are people who are now marrying robots. So that's now officially happening. Okay. I mean, we talk about kind of these quasi relationships with people, having a relationship with an online presence, but I think that's probably going to happen.
I suppose you could just take the batteries out when you're annoyed with it.
Well, that's a fair point, isn't it? But I am curious. So, because the health of men is changing fundamentally based on the environment, and of which tech and society is a part of it. Maybe there's also the environment in terms of what we're eating, drinking, putting into our bodies from water, toxins, microplastics, what we're wearing, etc. How do you think, Ollie, that has what's to play? And I think it's multifactorial, but I'd love to hear the testosterone argument, because we've spoken about this separately. There is a big difference with, say, the average level of testosterone for men, middle-aged men, say 50 years ago, and how that has declined over the years. And I'd love to hear your view on what that means for the younger men out there in 2026.
I think the big frustration is that the average 40-year-old in the Western world is at 13.7 nanomoles a litre.
Total testosterone.
Total testosterone.
Okay.
We'll stick to total testosterone for this.
Mm-hmm.
But most people will start seeing symptoms of low testosterone below 15.
Mm-hmm.
And we're being told we're not low on Western medicine models, which
on certain guidelines.
On certain guidelines. Yep. When we look at like the specific there, that around 8, it is low.
8.6, 8.7, and varies again depending on where you are.
Yeah. So guys are being told you're absolutely fine, but they don't know why they're feeling sluggish, they're feeling tired, they're feeling like they haven't got that sense of purpose, because these numbers are coming down. Now, I was speaking with a guy on my podcast who we were talking about where these ranges came from, and like the low just being plucked out of nowhere. It was just put down as that 8 is going to be the low, or whatever it was, 300 in the US was going to be the low. So these guys, it's frustrating. We're failing them as a system. And we actually look at the side of things, we look at research of where were highs and lows 30, 40 years ago, to the point of even highs being at like 38, now they're 29. And now people get their bloods done and they're at 37 and they're saying, your testosterone is high, it's too high. Maybe we need to do something about it. And they're literally never taking anything.
Yeah.
And even when we look at replacement therapy, in our guidelines, we can't put someone up to 39 and actually still follow the guidelines necessarily, right?
Safely,
yeah. But then that used to be a normal range of, say someone that's 34, it would be in the high normal range.
Based on average
Population. And so these markers for high and low are getting lower.
Yeah.
And also the average is getting lower as well.
Yeah.
And I feel it's just so worrying, because as we've said earlier, and as I heard it on a podcast, that stat with 140% more testosterone prescriptions for 18 to 25 since 2019. So it's not, I trust that source, but I haven't looked into the accuracy of the source.
Yeah. But that's in the US as well.
That's
right?
in the US, yeah.
It will be different in the UK.
It'll be different in the UK, but still, I would say it's very similar in the UK, given that we are following very similar Western diets. The standard American diet as such is pretty
tend
much
to follow generally the US, just trail behind.
Same habits when it comes to technology and everything else. And guys are then just being pushed away. Trying to get a blood test on testosterone through your actual NHS will just be more than likely just total testosterone, which might be fine, but actually you've got high SHBG, sex hormone binding globulin, which is then lower in your free testosterone.
And albumin as well.
Albumin, yeah, exactly. So these proteins that are in the system are binding onto testosterone, stopping us being able to use it. And it's worrying, because they're then told, oh, it's not your testosterone. Or even trying to get thyroid checked as well. And they're just, a lot of times, people are told that you're just depressed.
Yeah. Or they're switched to an alternative, right? So it might not be that it's normal. It might just be that's not the problem, and now look elsewhere.
Yeah.
And that's assuming that they even get allowed to have a blood test in the first place to check it.
It's easier for a guy to get antipsychotic medications than it is to get testosterone. And that's worrying, as in from legal routes.
Yeah.
We can get on a cocktail of these antidepressants as such and go on there. Now, if we were to look, again, this is my opinion, this is not a TED's health opinion or anything like that, is that if we were to look at just the psychological impact of getting testosterone to optimal levels, whether it's high, normal, even on like 27, 28 or whatever it is, with symptom resolution, even if we were just to look at the psychological impact of testosterone, I would argue you're going to get better results than an SSRI. That's my view.
If someone as well doesn't have a diagnosed mental health,
if it's based on testosterone, but also as well, on the other hand, we have guys that have symptoms which we could put down to low testosterone, that their testosterone's fine, they're eating crap, they're drinking a lot, they're sleeping 3-4 hours a night, they're stressed to high ends.
So the lifestyle is just not there.
They've got so many toxins in there, but then that's where we get the underground labs of that. People are saying that people are irresponsible. I'm in a few different forums on Facebook or groups in Facebook with TRT people. And there's a guy in there saying about this doctor won't prescribe me testosterone. And they're looking at his numbers and they're like, it was about 18, 19. Is that
probably was me, was that?
You weren't. Yeah, there's this guy, Johnny. It's like you pretty certainly won't get prescribed testosterone from anyone if they're responsible at 19 and is FSH, his LH was in okay levels. It wasn't high or anything or hit rock bottom. And then they asked questions further down the line of like, how much do you sleep? And then there was a picture of him, and it's not to judge someone by how they look, but he was overweight, like a lot overweight.
Which could be due to underlying sleep disorder, sleep apnea,
so we need to focus on those foundations. If we go on TRT and we are not doing those things, yes, testosterone may help you with the motivation to do those things, but we still have to focus on those things. Hence why, as I say, I work with people before TRT, improve to hopefully not need to use TRT. Just because we have TRT and TED's Health has TRT, it doesn't mean that we want to push it to every single person.
It's not for everyone.
Exactly.
In many cases, it is first with lifestyle foundational models first, and then it can be an adjunct where appropriate, and we've gone through everything else medically and discussed risks, benefits, etc., and what that looks like for a person.
Yeah, it's important for clinics to discuss the risks, and if you take TRT without doing those other things, you're just going to get side effects. And then you're probably going to then blame the TRT, which, no, it's your discipline, whether it's physical discipline, whether it's emotional discipline, whatever discipline it is, that they're then getting really high estrogen levels of side effects or whatever it is. They haven't cured their depression. They've then said that TRT doesn't work. No, it's the fact that you're drinking 7 Guinnesses on a Saturday night and like multiple times during the week or other beers. Is Guinness a beer?
Guinness is beer.
Yeah, it shows how much I drink. Other beers are available.
Of course,
other drinks are available, but then you're having a pizza takeaway 3 times a week.
Other foods are available.
Exactly. Also, you're not getting any sunlight. You're not getting outside enough. And people come all the time. And the amount of times I've had a couple of posts just really blow up recently, which meant there's been a lot of new followers, which is amazing. But then people have come in and said, I'm really depressed. Can't afford a therapist or anything like that. And so what can you do? And they're like, I can't do anything. But do you walk? I don't really go out. Well, first off, get out. Go and walk. Go and walk for a couple of hours a day. Go and walk for a couple of days. Do some breath work. But you're eating rubbish. Maybe you can't afford to eat 100% class as healthy, but you could pretty certainly eat better. Stop drinking alcohol. So actually add up, we talk about financial discipline, right? Add up how much you are spending on takeaways, how much you're spending on alcohol each month. Chances are you can afford to do your bloods then after 1 month and check exactly where you're at. And even testosterone therapy isn't that expensive when we actually look at the benefits people get. And then further down the line, they've then taken away the alcohol, they've taken away all the junk food because they no longer crave that stuff and they feel better. So then they get a bonus at work or whatever it is, or they're doing something where they're self-employed, they get more customers, they get a return as a result. And it's are we living in a society where a lot of people, we're being pushed this quick fix, and we think this quick fix, and the quickest way, what is it? Jocko Willink said something, the shortcut is a lie. It is true. Very, very rarely will the quick fix you long term.
Absolutely. And is it Ryan Holiday, who's the kind of stoic writer, who says the obstacle is the way?
The obstacle is the way.
That's actually the title of the book, and that's kind of the opposite, isn't it? Just want to quickly just recap on a couple of points, and I think also for anyone listening on kind of thresholds and blood testing and sort of my take on it. But still, I think, so when you look at any biomarker, so what's a biomarker? Somebody asked me the other day, and I said, look, it depends on what it is. There's even digital biomarkers, but these are essentially data points extrapolated from possibly lab tests, which may include blood and other biological sources to build a picture, okay? Now, if you have one person, it has to be correlated. So what do? We have reference ranges. We have a normal, what is considered a normal, and you've got high, okay? But where is that taken from? It's taken from tens of thousands, hundreds of thousands of people's data, okay? And then that is looking at averages, okay? And there's lots of clever statistics. We won't get into standard deviations and stuff. So where do you define, where does 8 come, or 8.6 or 8.7? I saw a wonderful table where actually there's, I think, 20 odd different NHS trusts across the country, 6 years old, bear in mind, and they do differ. So
with research, 6 years old is actually quite new.
10 nanomoles per litre, others are around.
And that's still in the NHS, right?
But that's in the NHS, so there is discrepancy. And then you've got also to acknowledge that labs process things in different ways. I was looking at somebody's free testosterone levels that were frozen from Qatar and sent to Germany. And when you convert it into nanomoles per litre, it looks like it's very low, but their total testosterone is very high. And I was just consulting, not actually a patient of mine directly, but speaking with their doctor and another doctor. I did all of this for free. Just, I said, look, this person, when they do come to the UK, this is, we need to get a brand new set of blood. So a fasting, early morning sample and see where they're at. Surprise, surprise, total and free testosterone were very good, were normal. So the problem isn't clearly that. You may have some symptoms and those need to be evaluated more. And obviously I did recommend to that doctor, look into your thyroid function and other things, right? Screen for dyslipidemia, look at your kidney function and liver function, look at your HbA1c, screen for prediabetes or diabetes. So you've got to build a picture because there are a bunch of secondary causes for hypogonadism or low testosterone. Now I think if you can tackle those, which may include losing weight, which might be, and there are, we won't get into strategies of that, but obviously there's effort as well. And people don't want effort, right? So if some people, yeah. But I think society has driven that way. We want the quick fix. And this is, a lot of private companies get demonized because they are seen to be offering a service, TRT, for example. And I would always caveat and say, look, there is a genuine need for these services, but in the right context, okay? These are people who have gone through everything else and they need to go through the proper full patient journey and have a consult and discussion and talk about all of these things, including the foundational work as well.
Yeah.
So I think, look, it's been a fascinating discussion today, gentlemen. I'm really glad that you joined us today on the TED Self podcast. Just like to close with maybe allowing you to say any final remarks. Let's go with James.
Listen, I think this has been such a great conversation. So thanks for having me along for it. I'd say it's great that there's podcasts like this, and we just need to reach men where they're at. I think, because my work that I do with the psychology side, we look at the research. Men are, unfortunately, their social networks shrink as they age. They tend to isolate more. Even when they do have friends, they don't open up with what's really going on for them. They're much slower than women to go to their caregivers if they've got a problem. Guys, let's start talking. Let's start talking to your friends. Ask them, what's going on for you? But actually genuinely mean it. Don't just skip to talking about the football or whatever. Let's have those open, honest conversations, because what I found in my experience, like when you volunteer something to someone, it kind of gives them permission to tell you something back in return. And people have said to me, oh, wow, I thought I was alone with this. So, guys, find the information, educate yourselves, have the conversations, get out there. It's so important.
Amazing. James, where can people find you or connect with you?
So they can find me at the Midlife Mentors, which is what I run with my wife, and then my own website, jamespdavis.com. And check out my book, The Midlife Male Handbook.
Absolutely. Thanks, James. Ollie, final remarks?
I think it's important to do our own research. And I've said that before. See something from me, do your own research. See something from you, do your own research. Don't just accept that people on social media have the backgrounds that, not necessarily that they say they have. I hope that you can trust these people, but what they're saying is gospel.
Yeah.
What they're promoting is the actual stuff. And realize as well, and that goes for AI as well, we need to do our own research into the stuff it says, but we have more control than we think of our health. it's been apparent to me that a lot of times we can go down that rabbit hole and essentially become a victim to the situation we're in. And we have control more than we think, just because we can't potentially think we can afford to go on testosterone therapy, or even need testosterone therapy, or even doing the bloods. I say to people, what's one thing you can add to your life to improve your life right now? Everyone will know one thing. And what's one thing you can take away from your life to improve your health right now? Everyone will know one thing. Start with those two things and just be consistent with that. And you'll get much further ahead than you even realize.
Amazing. And where can people find you, Ollie?
So on Instagram, Ollie Matthews Health, and then website is ojhealth.com, so ojayhealth.com.
Excellent. Well, thank you once again, both for joining
What's
me.
your takeaway?
Yeah, okay. I would just say, look,
We've only got like 10 minutes of left.
I would say, honestly, I think it's been a great discussion. I think, look, all of us are trying to create this platform with people with the experience, the knowledge. I think, look, I always like to be as transparent as possible. And I think there are differing views, there's differing agendas. So skepticism is important, healthy skepticism, but do go and speak to someone as well. I'm not trying to only plug tedshealth.com or OJ Health or Midlife Mentors. It was a bit of a plug.
Yeah.
But other providers are available. But make sure, do your research and maybe go and speak with your NHS GP, speak with others, speak with your family, speak with partners, have conversations. Because I think this is what I'm actually enjoying here, is actually having an in real life conversation. Yes, we are being filmed, and hopefully if you're watching this, you're enjoying it.
We're trying to spark those conversations, right?
But start those conversations. I think we have got a long way to go for men's health to really change the narrative to improve health. And I would just encourage anyone listening who is interested in anything that we're discussing to reach out to any of us. And if you are interested in featuring or joining the conversation, we'd love to hear your comments, and we'd love for you to reach out as well. Maybe you'll join us next time.